Welcome to South Georgia Career Center's Medical Assistant class, Chapter 8, Reproductive System. Contents in this chapter are: Female Reproductive System, Anatomy of the Female Reproductive System, External Organs, Labia majora, Labia minora, Bartholin's glands, Clitoris, Internal Organs, Vagina, Uterus, Ovaries, Fallopian tubes, Menstrual cycle, Follicular phase, Ovulatory phase, Luteal phase, Pregnancy, First trimester, Second trimester, Third trimester, Male reproductive system. Anatomy of the male reproductive system. Sexually transmitted diseases: Bacterial vaginosis, BV, Chlamydia, Gonorrhea, Hepatitis, Herpes, HIV, Human papillomavirus, Pelvic inflammatory disease, Syphilis, Trichomoniasis. Common medical conditions: Infertility, Impotence. Female reproductive system. There are two main parts to the reproductive system of women. The ovaries produce the eggs, and the uterus passes a male's sperm through to the tubes and carries the fetus. The conception, fertilization, of eggs occurs in the fallopian tubes. Once fertilization takes place, the egg is implanted into the uterus walls where the initial stages of pregnancy begin. If no fertilization took place, the system is built to menstruate. The female reproductive system also produces female sex hormones which maintain this reproductive cycle. Menopause is the stage in which the reproductive system slowly stops making these female sex hormones, therefore ending the reproductive cycle. Anatomy of the female reproductive system. The female reproductive system consists of parts inside as well as outside the body. The functions of the outside structures are to allow sperm to enter the body and to protect genital organs from infectious organisms. External organs. Labia majora, also known as large lips. Enclose and protect other external organs. Contains sweat and oil secreting glands. Covers with hair after puberty. Labia minora, also known as small lips. Located just inside the large lips. Surround the openings to the vagina and urethra. Bartholin's glands. Located beside the opening of the vagina. Glands produce mucus secretion. Clitoris. The two small lips meet here. Covered by the prepuce, the fold of skin. Sensitive to stimulation and able to become erect. Internal organs. Vagina, also known as the birth canal. The canal that joins the cervix to the outside of the body. Uterus, the hollow organ that carries the fetus. Divided into the cervix and the corpus. Corpus can expand, being able to hold a baby. Sperm can enter and menstrual blood exits via a channel through the cervix. Ovaries, small gland located on both sides of the uterus. Ovaries produce eggs and hormones. Fallopian tubes, narrow tubes attached to the uterus, upper part. Tubes aid as tunnels for egg cells. Menstrual cycle. Women in reproductive age, before menopause, experience monthly cycles of hormonal activity. With each cycle, the female body prepares for a possible pregnancy. The word menstruation refers to a monthly excretion of the uterine lining. An average cycle takes about 28 days, some cycles are shorter or longer, and happens in different phases: follicular phase, ovulatory phase, and the luteal phase. The menstrual cycle includes 4 major hormones: estrogen, progesterone, follicle-stimulating hormone, and luteinizing hormone. Follicular phase starts on the first day of the period. The brain releases follicle-stimulating and luteinizing hormones that travel in the blood to the ovaries. These hormones stimulate the growth of up to 20 eggs within the ovaries, each in a follicle shell. These hormones trigger an increased production of estrogen. As estrogen levels increase, the production of follicle-stimulating hormones stop. This function of balance allows for control of follicles that mature. As the follicular phase continues, one follicle will become dominant and mature. Ovulatory phase starts about 14 days after the follicular phase and is the mid-part of the menstrual cycle. The estrogen increase from the maturing follicle triggers the production of the luteinizing hormone. This causes the release of the egg from the ovary. The released egg is caught by projections on the end of the fallopian tubes. Cervix produces more and thicker mucus, which helps sperm move towards the egg for fertilization. Luteal phase. This phase begins after ovulation. Once the follicle releases the egg, the follicle will develop into the corpus luteum. The corpus luteum secretes progesterone, which prepares the uterus to implant the fertilized egg. If sperm fertilizes the egg, this egg will move through the fallopian tube and implant in the uterus. This stage is considered as being pregnant. If the egg is not fertilized, it will pass through the uterus as the uterus lining breaks and the period starts. Pregnancy. The average pregnancy lasts about 40 weeks and is divided into 3 trimesters. Symptoms of early pregnancy: breast changes, absence of periods, nausea, and/or mood swings. Symptoms of late pregnancy: heartburn, swelling of ankles and fingers, and/or sleep problems. During prenatal care, doctors use pelvimeters to determine a female pelvis in relation to the birth of the baby. At 37 weeks, a baby is considered the full term as his organs are able to function on their own. Near due date, the baby might turn into a head-down position for the birth. Babies generally weigh between 6 to 9 pounds and are usually 19 to 21 inches long. After giving birth, women experience physical and emotional changes and therefore receive postpartum care. First trimester. The first trimester refers to pregnancy weeks 1 to 12. Hormonal changes in the first trimester affect almost every organ. Even in the first trimester, these changes can trigger symptoms such as tiredness, swollen breasts, mood swings, cravings for food, throwing up, morning sickness, headaches, heartburn, and/or weight loss or gain. Second trimester. The second trimester refers to pregnancy weeks 13 to 28. This trimester is found to be easier than the first. Symptoms from the first trimester now usually begin to fade. More noticeable changes to the body will occur. Symptoms may include growing belly, body aches, stretch marks, numb or tingling hands, darkening around the nipples, and/or swelling of fingers, ankles, or even face. Third trimester. The third trimester refers to pregnancy weeks 29 to 40. Symptoms can include difficulty breathing, more frequent urination, heartburn, tender breasts, trouble sleeping, further growing belly, and/or contractions may occur. Near the due date, the cervix becomes softer and thinner, which helps the vagina to open during birth. Male reproductive system. The following contains information about the anatomy of the male reproductive system. Anatomy of the male reproductive system. External organs. Penis. The organ which is used for intercourse. The penis consists of 3 parts: the root, attaches to the abdomen wall, the shaft, and the glans. Penis head, covered with the foreskin. Removal of foreskin is called circumcision. Transport of semen happens through the urethra, a tube at the tip of the penis. The penis body has 3 chambers, circular shape, that are made of sponge-like tissue. This tissue has spaces that fill with blood as a man becomes aroused, therefore erecting the penis. As the man reaches the orgasm, climax, semen, the reproductive cells, are expelled through the end of the penis, scrotum. The pouch-like sac that hangs below the penis contains testicles, nerves, and blood vessels. In order for normal sperm to develop, testicles must have a temperature a little cooler than the body temperature. Muscles in the scrotum wall allow for relaxing and contractions. Testes. Oval-shaped organs located inside the scrotum. Responsible for making the primary male sex hormone, testosterone, and generating sperm. Seminiferous tubes, located within the testicles, are responsible for sperm cell production, internal organs. Epididymis. Mass of coiled tube located against the testicles. Transports, stores, and matures sperm. During arousal, contractions move sperm into the vas deferens. Vas deferens. Known as the sperm duct. The muscular tube that transports sperm to the urethra to prepare for ejaculation, semen release. Seminal vesicles. Sac-like pouches that attach to the vas deferens. Produce fructose to provide sperm with energy. This fluid makes up most of the ejaculatory fluid, prostate gland. Located below the urinary bladder before the rectum. Contributes additional fluid to the ejaculate. The urethra runs through the prostate gland. Bulbourethral glands. Also known as Cooper's glands. Located on the sides of the urethra below the prostate gland. Produce a clear fluid that empties into the urethra. The fluid serves to lubricate the urethra as well as to neutralize any acid in the urethra. Sexually transmitted diseases. The following contains information about sexually transmitted diseases. Bacterial vaginosis, BV. A condition where the normal balance of bacteria in the vagina is disrupted. Most common vaginal infection in women of childbearing age. Symptoms can include abnormal vaginal discharge. Can be diagnosed by examination of the vagina or laboratory tests. Treatment includes the use of antibiotics. Chlamydia. A condition caused by bacteria called Chlamydia trachomatis, that can damage the reproductive organs of women. Most frequently reported bacterial STD. Transmitted during oral, vaginal, or anal sex. Symptoms may include abnormal vaginal discharge in women and/or burning sensations while urinating, abdominal pain, fever, or nausea. Symptoms in men may include discharge from the penis and/or a burning sensation while urinating. Laboratory tests may be done to diagnose chlamydia. Treatment includes the use of antibiotics. Gonorrhea. Caused by the bacterium Escherichia gonorrhoeae. Very common infectious disease. Caused by contact with genitals, penis, vagina, the mouth, and/or anus. Symptoms in women may include painful urination, vaginal discharge, and/or bleeding between the menstrual cycle. Symptoms in men may include burning sensation while urinating, colored discharge from the penis, and/or even swollen testicles. Laboratory tests can be performed to diagnose gonorrhea. Antibiotics are used to treat this disease. Hepatitis. There are 3 types of hepatitis: A, B, and C. Hepatitis A. The incubation period of about 28 days. Transmitted by the fecal-oral route. Symptoms include rash, diarrhea, vomiting, and/or pain. Diagnosis is reached by serologic testing. Treatment is done by medications. Hepatitis B. The incubation period between 6 weeks to 6 months. Transmitted through unprotected sex. Symptoms include fatigue, vomiting, and/or dark urine. Diagnosis can be reached with serologic testing. Usually resolves on its own. No medications are available to prevent hepatitis B from becoming a chronic condition. Hepatitis C. The incubation period between 1 to 6 months. Transmitted by any source of blood or blood products. Symptoms include diarrhea, nausea, pain, and/or fatigue. Diagnosis can be reached by screenings or blood tests. Treatment involves the use of antiviral medications. Herpes. The incubation period between 6 to 8 days. Transmitted by direct skin or mucous membrane contact. Symptoms include burning sensation in the genital area, fever, pain in the genital area, pain while urinating, and/or genital discharge. Can be diagnosed by examination or testing samples from sores. No cure. Antiviral medications are used to treat this condition. HIV. HIV is the virus that causes AIDS. The incubation period varies depending on the individual. Most commonly transmitted through sexual contact, needle sharing by drug users, and/or from mother to child during labor. Symptoms include sore throat, fever, and/or swollen glands. Diagnosis can be reached through an antibody test called ELISA. If the antibody test is positive or reactive, a confirmatory blood test is done, called the Western blot test. There is no cure for HIV. Antiviral medications are used to treat this disease, human papillomavirus. Most common STI, sexually transmitted infection. Transmitted usually direct skin and/or direct genital contact. Symptoms may include genital warts and/or even cancers. Diagnosis is usually made based on Pap smear results, women, although there are no tests to detect HPV in men. There is no cure for HPV and usually, the body rids of the virus itself. Treatment can include treating symptoms such as warts, pelvic inflammatory disease, infection of the female reproductive organs, a complication of STDs such as gonorrhea and chlamydia. Causes are untreated sexually transmitted disease. Symptoms include fever, vaginal discharge, painful intercourse, and/or abdominal pain can range from mild to severe. Diagnosis can be reached by physical examination and/or testing for the presence of chlamydia or gonorrhea. Treatment can involve several types of antibiotics. Syphilis, caused by the bacteria Treponema pallidum, commonly caused through sexual activity with an infected person. Symptoms vary with each stage. Primary stage, small sore appears where the bacteria entered the body. Secondary stage, rash develops, eventually covering the entire body. Latent stage, the infection continues with no symptoms present. To diagnose syphilis, either the sore can be examined or by blood tests. An antibody test called Wassermann test can also determine syphilis. If treated in the early stages, syphilis is easy to cure with antibiotics. If left untreated, syphilis can cause complications. Trichomoniasis. Symptoms usually affect women more commonly. Caused by Trichomonas vaginalis. In men, the urethra is the most common infection site. In women, the vagina is the most common infection site. Transmitted through penis to vagina or vagina to vagina contact. Symptoms include vaginal odorous discharge, discomfort during sex or urination, as well as itching of the genital area. Physical examination is performed to determine this condition. Usually treated with medications. Common medical conditions. The following contains information about some of the different medical conditions of the reproductive system. Infertility. Biological inability to contribute to the reproduction. Causes for both sexes can include genetic factors, environmental factors, and/or general factors. The cause for infertility in men is mostly a deficiency in semen and low semen quality. Causes for infertility in women range from age, tubal blockage, uterine problems, and/or problems with ovulation. Infertility can have a high impact on the psychological state of the affected person. The person affected by infertility may be anxious, fall into depression and/or emotional stress. In certain cultures, infertility can lead to rejection in closed social, cultural groups. Treatment for infertility may include medical treatments as well as alternative treatments. Impotence. Sexual dysfunction characterizes itself in the inability to maintain an erection of the penis. Causes can vary from psychological disorders, age, surgery, drugs to a person lifestyle. The main symptom is the inability to maintain an erection of the penis. Tests can be performed to see whether it is psychological or physiological impotence. Such tests are duplex ultrasound, penile biophysiometry, nocturnal penile tumescence, dynamic infusion cavernosometry, corpus cavernosometry, and/or magnetic resonance angiography. Treatment of impotence depends much on the cause. Treatment may be as simple as exercise or may include medications.